Students, welcome to the next session of the general medicine series, and today's topic will be mainly focusing upon the Sjogren syndrome. So Sjogren syndrome, it is one of the autoimmune conditions, and this Sjogren syndrome, first of all, this topic I'll be taking up, and today's video will be mainly focusing upon the causes, that is the etiology of the Sjogren syndrome, and the clinical features. So students, beginning with this Sjogren syndrome, just a brief history of the Sjogren syndrome. So beginning with the this Sjogren syndrome was first of all described by a Swedish ophthalmologist. His name was Samuel Conrad. In the year 1933, he described this Sjogren syndrome. So it was Samuel Conrad in 1933 who described this Sjogren syndrome for the first time. And initially, this Sjogren syndrome, what it was actually, this Sjogren syndrome would be consisting of a triad. That is, this syndrome would be comprising of three things. That this triad would be comprising of the dry eyes, the dry mouth, and the rheumatoid arthritis. So in the patients, initially what it was found that this Sjogren syndrome was a triad of the dry eyes, the dry mouth, and the rheumatoid arthritis. But later on, it was found that in some of the patients who are affected with this dry eyes and dry mouth, they also manifested with some of the collagen disorders, such as the polyarthritis nodosa, the systemic lupus erythematosus, and the rheumatoid arthritis. So this was another features which were found in some other patients. So initially, the Sjogren syndrome, the correct pronunciation for this is Sjogren syndrome. So this Sjogren syndrome, initially it was in most of the patients, the dry mouth, the dry eyes were present, and in this dry mouth and the dry eyes combination, it was called as the primary Sjogren syndrome. While in another cases, another set of patients who were complaining of this dry eyes along with the dry mouth, they were also complaining of certain collagen disorders, which could be in the form of the dry eyes, and the dry mouth could be accompanied by certain other disorders such as the systemic lupus erythematosus, the polyarthritis nodosa, and the rheumatoid arthritis. So this was again categorized into the secondary Sjogren syndrome. So students, this is what I have made. It is the chronic immunologic disease, and that too, it is a chronic immunologic disease. What is going to affect the systemic disease, chronic immunologic systemic disease, what it is mostly going to affect the salivary, lacrimal, and the exocrine glands. So students, the Sjogren syndrome, when we are asked to write about the exact definition for it, so the Sjogren syndrome can be defined as it is a chronic inflammatory systemic disorder which is mostly affecting the salivary glands, the lacrimal glands, and the exocrine glands. So students, while looking at the etiological factors as to what is the etiology or the causes for this Sjogren syndrome, so since it is an autoimmune condition, so the first and the foremost cause what needs to be discussed is about the autoantibodies. So beginning with, in the patients of Sjogren syndrome, what is there? Autoantibodies, the suppressor T lymphocytes and the B lymphocytes, they are producing antibodies against themselves, and these antibodies are going to act upon these only cells, that is, that suppressor T lymphocytes and the B lymphocytes, they are going to produce antibodies for themselves only, and that can lead to a further reduction in the counts of the suppressor T lymphocytes and the B lymphocytes. So moving on, this was the first condition where the autoantibodies are formed, and Sjogren syndrome, since it is an autoimmune condition, so autoantibodies are formed, and the basic mechanism underlying this, the inflammation of the dryness, that is the xerostomia, the dryness of the mouth, the dryness of the conjunctiva, that is the keratoconjunctivitis, what is mostly seen in the patients of Sjogren syndrome. So the etiological manifestation, which mostly occurs in the form of inflammation of such glands, that is the exocrine glands, the lacrimal glands, and the salivary glands. The basic underlying mechanism, what is there, it is that these autoantibodies, they are going to get accumulated at such sites. So wherever the sites of the are the sites where the lacrimal glands, the salivary glands are present, these autoantibodies are going to get accumulated, and this misleading collection of the autoantibodies can further lead to the inflammation of such tissues. So this was the first condition, the first etiology, that is the production of autoantibodies by the suppressor T lymphocytes and the B lymphocytes. Moving on to the next etiology, in most of the patients of Sjogren syndrome who are reporting to the clinic, that is in the laboratory diagnosis, when we go for the laboratory investigations, what we find is the patients, they are mostly suffering from the disease, what is known as the polyclonal hyperglobinemia. So polyclonal hyperglobinemia, it is the disease what is mostly found in the patients who are suffering from Sjogren syndrome. And in this disease, that is the polyclonal hyperglobinemia, there is an increased amount of the immunoglobulins, that is the IgG and the IgM. And this excessive production of this IgG and IgM, the increased levels of IgG and IgM is going to is going to be one of the cause for the clinical manifestations of the Sjogren syndrome. So this is another cause. Moving on to the next third possibility, the third etiological factor, what can be looked upon as, it is the genetic predisposition. So the genetic predisposition, when talking of, so there are certain the HLA linked genes and the non-HLA linked genes. So when talking of the genetic predispositions, in some individuals there can be an association with the HLA complex, that is a human leukocyte antigen, and in some cases there can be an association of the non-HLA linked genes. Moving on to the fourth etiological factor, that is the fourth cause, in some of the patients it is found that the natural killer cell, that is the NK cell activity is impaired, that can further lead to the Sjogren syndrome. Moving on to the clinical features. So when talking of the clinical features, it is mostly found that this Sjogren syndrome, it is an autoimmune condition what is mostly found in the elderly age group women, that is the women who are above the age of 40 years. It is mostly, the Sjogren syndrome is mostly manifested in, predominantly it is found in the women of the older age group, that is the above that is who are above the age of 40 years. And in some of the cases it has been also found that some young adults as well as children may also be affected. And when talking of the predilection, so when talking of the predilection, that is the male and the female ratio, in such condition it is that in males it is rarely, that is the ratio between the male and the female is 1:10, that the disease, this shows that the disease is predominantly found in the female population, that is the younger, that is the older female individuals, they are most prone to the disease. So while looking at the clinical features, so the clinical features may be manifested in the form of dry mouth and the dry eyes. So the dry mouth, the technical term, the medical term what we use is the xerostomia. So xeros means dry and stomia means mouth. So the patients who are suffering from Sjogren syndrome, the primary, particularly the primary Sjogren syndrome, it is the presence of only, in some class of the patients it has been found that there is presence of only xerostomia and dry eyes, that is the keratoconjunctivitis can occur, and this condition may result due to the hypofunction of the salivary and the lacrimal glands. So students, whenever there is an hypofunction of the salivary and the lacrimal glands, what it is going to happen is this can lead to certain kind of a pain or a burning sensation and ulceration of the nasal and the conjunctival mucosa. So this is mostly seen in such patients. And if some patients they are not there are it has been found that in some of the patients there is no xerostomia or dryness of the eyes and mouth. If it is not occurring, the patients they may also complain of an unpleasant taste or soreness in the throat. So it is also because of the it is one of the it can be looked upon as a condition which is mostly seen in the Sjogren syndrome. And moving on to the next and the minor things, that is the other glands such as the nasal, the bronchial, and the vaginal hyposecretions can also be found in this condition. Along can be also be associated in the cases of Sjogren syndrome. And in some of the cases, if it is as secondary Sjogren syndrome, along with the dryness of the vagina, along with the reduced secretions of the nasal, bronchial, and vaginal secretions, the rheumatoid arthritis can also be seen in some of the patients. Moving on, in some of the patients, while talking of the next clinical features, that when talking of the primary Sjogren syndrome, in the patients of primary Sjogren syndrome, what we can find is that there is the dryness of the mouth and the dryness of the conjunctiva, that is the keratoconjunctivitis, and the xerostomia can occur. And in some of the patients, it has been mostly found that the parotid gland involvement is also there, which can manifest in the form of the parotid gland swelling, enlargement, either unilaterally or bilaterally. And in some of the conditions, it has also been found that the patients may also show the symptoms of purpura and lymphadenopathy when talking of the oral manifestations. So in Sjogren syndrome, the oral manifestations becomes very important. They are mostly seen. The oral manifestations comprises of the dryness of the oral mucosa can occur. In some of the cases, the mucosa may they may show a glazed appearance, that the mucosa may become more of a shiny appearance. The glazed mucosa can occur. And in some of the patients, when they are speaking, that a clicking sound is heard just because of the dryness of the entire oral mucosa. What it is going to happen is the tongue is going to stick to the hard palate, the tongue is going to stick to the palate, and when the patient speaks, there can occur clicking in the sound also. Whereas in most of the patients who are not complaining, if some patients some of the patients may not complain of complete dryness of the mouth, so such patients may also complain of that they are going to have an unpleasant taste in the oral cavity, unpleasant burning sensation, unpleasant taste along with burning sensation, and there can occur soreness in the upper respiratory tract. So this can also be occurred, and such patients can also complain of that they find it difficult to take dry food. So one thing I've missed over here, in some of the cases, in some of the patients what report to the OPD of the Sjogren syndrome, they mostly complain of that is since there is the overall hyposecretion of the exocrine glands as well. So the bronchial secretions, they are in the upper respiratory tract, the bronchial secretions are further reduced, and this can further manifest in the certain forms of pneumonia can occur. So students, this was a short discussion about the etiology and the clinical features of the Sjogren syndrome. In the upcoming videos, I'll be talking of the radiographic features and the laboratory investigations. So students, if you do like this video, just give this video a thumbs up. If you do have any queries or comment, don't forget to comment me in the comment section. And students, those who have not subscribed my channel, please do go and subscribe my channel and do press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.